Hey guys, welcome to Mental Health with Jeremy, where it's all about mental health. This is just a real quick video on the side effects of Prozac. These are the most common reported. This is like the most common emails and questions and comments I get is what are the side effects of Prozac. So I'm going to run through a real quick list. We'll start off with psychological and then go to physical. So basically the most common would be increased nervousness because Prozac is stimulating. When I was taking Prozac, it does kind of give you energy, so I definitely had to take it in the morning. Most psychiatrists are going to tell you to take this medication in the morning. Another one would be unusual dreams, which is actually quite common with any psych med. Really, that's a real common side effect of all psych meds. I mean, it's not like a real big deal. You just gotta deal with it. But another thing would be like confusion. You might feel cloudy. Your brain might feel cloudy. I personally never experienced this, but it is reported that it has happened before. That is something to think about. Another problem might be memory issues. Now, I never had any memory issues while I was on Prozac. I did have that for other medications though, because I was on like Ambien for many years and that was giving me memory issues, and then some of the antipsychotics I've tried in the past gave me that, so, but I never got that on Prozac. Another thing would be agitation, which also I can see because like I said, it is stimulating and you will feel a little bit of energy. Most people do. I mean, it's not like a high or anything. You're just gonna feel energy. The most serious psychological thing that you could get would be hallucinations, which to some people are scary if you have never experienced that before. I am kind of used to it. I am schizoaffective. If I don't take my antipsychotics, I hallucinate. So, but yeah, that's probably the most severe one you're gonna get psychologically. A lot of people are gonna find that hard to deal with. We will move to physical now. The most common is insomnia for physical, so you might have to, just work on sleep maintenance, maybe exercise or stuff like that, and if that don't work, you can get onto melatonin, which I take right now. It is a very safe medication for sleep, and it is non-habit forming, and it is all natural, and I have no side effects with it. If it is severe, I recommend maybe trying Ambien, but do not take it every night because I did that for many years and I turned into a lot of problems. Another thing would be nausea or diarrhea. You just want to make sure you're drinking fluids, like lots of clear fluids, to make sure you don't get dehydrated. If you are feeling kind of upset, try after food. They kind of recommend doing that. If you're feeling sick, take it after you eat. Maybe when you wake up in the morning and eat breakfast, maybe you should take it right after then. I think that would probably help that problem a lot. Another thing, like I said, dry mouth. That's actually pretty common. With all these mental health medications, you want to keep up the water and intake. It's just, you just want to do that. Loss of appetite is also common. I did not really experience that. My appetite did not change at all, so I don't know, but some people have got it. Me personally, I didn't. You can also get tremors. If you're, I don't know, some people might get this, some won't. I never got tremors. My whole Prozac experience was really good as far as side effects. Just keep in mind that is something that has been reported, that people get tremors sometimes. You can also have sexual problems, especially in men, like you can't orgasm or anything like that. That might kind of suck if you're a dude, but that is a possible side effect when it comes to most mental health medications, especially antidepressants. You can also get extreme sweating. That is another reason to keep up on your water intake, because that is very important. You do not want to get dehydrated while taking psych meds. You really don't. You're just going to feel shitty. Something worse would be maybe irregular heartbeats, also known as palpitations, something like that. Yeah, that is actually common when it comes to taking mental health medications. Like you could be sitting there and all of a sudden you'll feel like you know, and that's just, you know, of course you want to bring it up to your doctor so they know about it, because it could be a different problem. Just know that that actually is kind of common. I take antipsychotics and I take Wellbutrin right now, so I do get that. I'm just kind of used to it, but I also have anxiety issues too, so that could be it too. Let's see, I think the last one would be fainting and seizures. You can get seizures on antidepressants if you're taking too much. Certain types have more chances of that happening. Obviously, if you're fainting or having seizures, you definitely want to tell your prescribing doctor about that, because this probably ain't going to work for you and you're going to need to find something else. Most of the time, it's probably not going to be life-threatening, but it's not fun to be living your life like that. Actually, I forgot, there's another one too. That would be like abnormal bruising. Let's say you hit your arm or something like that, and you will bruise it will be like a big bruise, you know, or you can cut yourself and you'll just bleed and bleed and bleed. It's like kind of a common but serious one too to look out for. As far as side effects, that's all I really know. Like I said, with my experience with Prozac, it was really smooth. I had no side effects and I felt great. No depression, no nothing. Anxiety was awesome, you know, so you know, that's all I gotta say. Prozac is a good medication. If you have any more questions, just send me an email, jeremygriffin86@gmail.com, or leave a comment. I reply very, very fast. Definitely send me an email if you want to keep it private. I will keep everything private, so I understand that mental health is something some people don't like to talk and share. So I want to thank you guys for watching. Thanks for watching my videos. Thanks for looking at the channel, and I will see you in the next video. Thanks, guys.